Hey, welcome back.
Hey,
Hey, I'm Rick Sorensen,
I'm Greg Camp.
and we are here with Healthier Ever After, talking about health, lifestyle changes, weight loss,
Yeah.
all the good things.
All the good stuff.
Yeah, tonight we want to kind of change course just a little bit, but not really so much. I
Yeah.
mean, it's all the same thing, but this one's going to be fun. I think we're going to probably end up with a few episodes talking about this because this gets, we don't have like a 4-hour thing, but
Yeah.
I mean, this is something I know Greg gets excited about talking about
I know.
some things. So educational and informational purposes only, really. We are certainly recommending always that before you start any medication, weight loss program, exercise regimen, that you discuss that with your medical provider.
Yeah. And this topic is definitely no different.
Yeah.
More importantly so than even some of the more mild things. This is definitely one that you don't want to go it alone, or as they call it, the bro science. This thing,
Bro science.
Bro science.
Yeah, don't bro science this one.
Yeah, don't bro science this one. Work with a medical provider to get dialed in if you have any questions, or if this is something that interests you. This is not something you want to be guessing at.
Yeah. So really, we've talked a lot. Last time we talked a little bit about how groundbreaking, game changing, I think is what we said, GLP-1 medications have been, and all the evidence and things, and really we want to kind of shift a little bit now to something I know Greg has talked about with so many people about, and that is hormones, and let's just hit men's health tonight.
Yeah.
We're going to do a few episodes on that, on women's health, because there are some specific things. But I think one of the most interesting things to me is the science behind this, and our understanding of the risks and the benefits and the effects of aging and how that affects hormones has really increased even in the last few years.
Absolutely. And how it all ties in. We talk a lot about, of course, obesity and all the effects there. And it's the hormones. You can't really talk about that without having a hormonal component, because it affects your hormones. And I will say that in my experience, being in the clinic of dealing with wellness, it rarely do I have an appointment, whether the patient is 20 or 80, that they ask about hormones, right? They're wondering, where are my hormones? Where are they supposed to be? Could that be a factor in this? And the answer is maybe. And usually needs
a big fat maybe.
It's a big maybe. Let's check some labs.
I would argue that it's a probably.
It's a probably. I agree. It's a probably. And how much is it? Does it affect them enough to where they actually need to be on some kind of hormone replacement therapy? Maybe is once again the answer there. And but we're going to dive into some studies here. We're going to talk about kind of the factors that I think a lot of people put medical things in boxes. And we're going to kind of talk about how this is all interrelated, how hormones and obesity and how one feeds the other and vice versa. So your testosterone in males tends to drop over time, and how that affects weight gain, especially in the midsection and that visceral fat that is so known to be so dangerous. And so we're going to talk about all of it.
All right. So let's see. So some of the listeners may relate to this or know someone. Like, let's just imagine you've got a male patient. So man in his 40s or 50s, he's gaining weight around the midsection, losing a little bit of muscle mass despite working out. He's feeling a little mentally foggy, got low energy, low drive. He's increasingly irritable.
Yeah.
His doctor says everything is normal for his age. Like, this is what happens to men.
Yeah.
And sends him home. So what?
Yeah.
Like, what's the core tension there? Like this is okay. This is something that happens now. I guess what we've kind of learned, if you paint this picture, what we've learned recently is that this is a real thing.
Yeah.
A lot of this is related to testosterone decline. It's a real thing, and it's been accelerating.
Yep.
But so has the science to address it. It's finally kind of catching up.
Yes, which is nice to see.
So I don't know. What do we want to talk about? Like, kind of the crisis, the quiet crisis behind how testosterone is falling from generation to generation?
I think we talk about that and dive into kind of what the data shows is what is happening to us, because I think we now have enough data. We've been looking at this long enough to realize what the, some of the, we've been seeing it as medical providers for a long time, especially that when we're in like family practice, me and Rick, when we're not doing our wellness stuff, work in the emergency department. So this doesn't get brought up nearly as often there. But, as far as family practice and in the wellness side of things, I mean, it gets brought up all the time. And the common story is exactly what you just read. I'm feeling foggy. I work out. I don't really like it feels like I used to be able to work out and actually get results, and I felt good. And now it just doesn't seem like it does anything. And my recovery's poor. And I'm, my wife says I'm irritable and I don't want to do anything. And my motivation is lackluster at best. And, the honeydew list is getting longer and longer. So, we hear this all the time. And then, yes, they go to their primary care provider. They check a total testosterone, which is just one metric in all of this. And they tell them, look, you're fine. Total testosterone's in the normal range, which is in many cases, they have all the symptoms of low testosterone. And yet they get a number on a piece of paper and you're fine. It's
just what happens.
Pull yourself up by the bootstraps. And most guys, for the most part, for all these years, that's exactly what they've done. They've just been,
okay,
yeah, my mood's not great. I guess I just am going to feel crappy forever. And that's just how it is to be a man and be alive. And it's really not the case, short of any other, medical problems going on. Oftentimes it is that their testosterone is lower. We know proven to be most likely lower than their counterparts 20, 30, 40 years ago. Sorry about that.
Right. All good. I was going to say something but no, our phones ring sometimes. That's all right.
Sometimes my phone rings. So it really just ends up coming down to this kind of frustration by a lot of men that are like, you know what? I go in, I get checked. To Rick's point, I think that there's just because of the information age and where we live and the time we live in, thankfully, the research is catching up. Thankfully, this has been brought to a lot more men's attention. I have so many more guys that are even in their younger years, under that 40 and 50 mark that are coming in and just want to see where everything's at. They're like, hey, look, I'm maybe not feeling as good as I did in my 20s. I'm in my 30s now. I have a family. I want to see if it's just life or if there's actually an abnormality. For some of these, I get their levels back and they look really pretty dang good. And we can talk about some lifestyle things to see what we can do there. And for others, their levels are very low and definitely require intervention if they want to start feeling better. And that unfortunately has been dismissed over the years because I don't know if it's just old hat medical stuff or
well, and a lot of it, it's you don't incorporate things into your practice that you don't know. And a lot of this, some of this is part of this is that it's changing. There's good research now that shows men today have a significantly lower testosterone level than men of the same age in previous generations. Right. So, and it declines about 1% a year. So that means like a 30-year-old man in 2025 typically has less testosterone than a 30-year-old man did in the year 2000. So that's not, I mean, that's evidence that we see that something is happening that's accelerating this and making it more common, and it's occurring younger than it did. So this isn't the same thing as the medicine we did in the 80s, because you might have been a little more right back then to say, hey, you know what, you're probably okay. But more and more people at earlier and earlier ages are not okay.
And I get this question all the time, and because like really a lot of the things that we know about this and this declining over these, every decade, it's that much lower for the next decade. And there's a lot of theories on this, and the running theories are obviously our food, less activity, right? A lot of people work a lot more sedentary jobs that are not outdoors. And so there's a lot of theories amongst that. The microplastics, there's just so many things that are happening that, our lives really, in this era are just a lot easier than they were before. So some of the theory is that like some of the things that really we know drive testosterone levels, frankly, we just don't deal with that on a regular basis. Now it's just, like I said, a lot of us are sedentary for our jobs. We sit a lot and we don't do a lot of moving. That's a little bit different than everyone that used to be a farmer, butcher,
right.
Whatever, their job was. It usually was outdoors and busy and active. And so, there's a lot of evidence that, even like the stuff that we talk about a lot, which is obesity, that like we have a more obese population, and obesity is one of the biggest driving factors metabolically of driving testosterone down. So is it because testosterone levels are dropping, or are we getting
more obese,
and that's driving the levels down on its own? And so the counter to that we would talk about is, and I think me and you have talked about the study. In fact, I think you're the one who probably sent it to me, is that there was a study done with tirzepatide, and I'll have to pull that up and post it somewhere so you guys can see it. But these participants, it was a smaller study, got on tirzepatide, and lo and behold, they started losing weight, and what happened? Their testosterone levels increased. So no direct testosterone injections or anything that would otherwise increase their testosterone. They just got on tirzepatide,
and their body did better making it.
Yep. So lo and behold, we know that there's a bunch of metabolic factors, and it's really just gotten to the point where, regardless of the reasons, guys are feeling it.
Yeah.
And
well, and a lot of times I think we think about, you say testosterone, and it's the sex hormone, right? It drives sex and your libido, but I mean, there are a lot of more things. Maybe you could just talk a little bit about that for a second. Like it's tied not only to sexual health, but to energy level. You mentioned that muscle mass, bone density, mood, cardiovascular health. Like this is not the sex hormone that we were taught in the 80s.
So it's a sex hormone, and that's what we typically call it. But it just has such a vast effect on the body. It's so important, just like women's hormones, which we'll talk about in a different episode, probably a couple episodes from now. But it's so important for mood. I mean, when you say mood, I think of one specific patient that came to me in family practice that was just. Things had changed over the last couple of years. His mood went down. He came in for depression, to be evaluated for depression. Now, at this time, I was of the notion of most family practice providers. Hopefully, I think that's evolving now. But that, look, if someone's asking about testosterone, it's because they want muscles up to their ears and they just want to get jacked and all this stuff. And we just did. I mean, it was in my education. It was who the provider that I worked with was kind of a older generation that truly was adamant that anyone that wanted to be on testosterone really was just looking to get jacked, and they didn't need that. And so it was interesting because we kind of went through the whole checked some basic labs, looked at a few things, and this guy just was like, I even brought up depression, and he was pretty like, look, I'm not depressed, but I am down. I just don't know, something's not right. Eventually, through some research and me just kind of like light bulb, I'm like, I need to check this guy's testosterone level. We check his testosterone level. It's in the tank, right? It's like 100, which for anyone that doesn't know, that's, a total testosterone of 100. You have some females that are higher than that. And so which females tend to have lower levels than men. So of course, this guy was struggling. We get this guy. We talked about putting this guy on antidepressants and all these things. And instead, we ended up putting them on testosterone. Well, lo and behold, who comes back in almost skipping into the clinic. He feels so much better. His mood's so much better. His wife comes with him. She is absolutely thrilled. And her statement, I will never forget. I can see the look on her face. And she says, my husband's back.
Wow.
And it was incredible to watch. And here I'm telling this guy, let me put you on a antidepressant medication and all these other things. We would have truly been just masking this symptom of low testosterone, but because of, and we talked about it in the last episode with GLP-1s, because of stigma and stereotype, and really just being behind on the data. We have the data that shows this is a good thing, and especially for men that do have low testosterone, but yet I was sitting there trying to find every reason not to put him on testosterone.
Yeah.
And that really was life-changing to watch that. Like it changed the whole way that I viewed my practice when I saw how this affected this guy. And now I've seen it so many times for these guys that, it's not always the problem, right? It's not always the issue. Sometimes guys just have depression, but, to not rule that out as a possibility,
right?
You're not doing your patient any favors. And so you talked about bone strength, muscles. I mean, people are meant to have good, strong, solid bones, which testosterone and estrogen are like friends, and they drive each other. And there's this big feedback loop of how that all works. And unfortunately, as your testosterone drops, your estrogen, that ratio gets off and your estrogen levels drop. And unfortunately, we know that can result in having weaker bones. This means that, grandpa falls down and has a higher incidence of hurting himself. We know that obviously lower muscle mass is going to lead to all kinds of metabolic issues. You don't burn as many calories just to live and breathe. And so you start getting that nice belly, stuff around the waist that is not favorable. And so it's just, it affects so much.
So it affects all these things. And I guess one of the things I think we can talk about, women have menopause, right? And that's viewed as more of an event that just happens, and it explains a lot. And it kind of, women age to a certain point, and then boom, menopause happens, and that changes the hormone milieu, and then we deal with that, and we'll talk about that one a whole nother, like you said, a whole nother episode. Men aren't really thought of as having an event like that, right? Like it's not menopause, it's not there's not an event like that, or it's not thought of like that, at least. But in reality, it's kind of the same process, a male version of the same thing, but it happens over a much longer time.
Sure.
Right?
Yeah. Women, I mean, they have perimenopausal symptoms, and they can have things that obviously can extend over.
Yeah. And I'm not saying it's a day-to-day thing, but sure, that's how we view it, and that's how we talk about it.
Yes. And the much shorter time frame for those drops are men. Testosterone drops over, let's say, if a woman goes through stuff for 2 to 4 years, totally, until they've completely gone through menopause. And I'm just giving some general numbers out there. That's, that's not in a science, everyone's a little bit different there. I just know that people that talk about women's health will maybe attack me if I generalize too much.
You guys are guys that don't know anything.
Yeah.
Probably true.
The men do this over let's say a 20-year period. Yeah. So it's the proverbial frog that's in boiling water. I mean, they just, because it slowly declines, right?
And that makes it harder for people to diagnose, to recognize, to address.
And arguably more dangerous, right?
Yeah.
It is the proverbial frog in the boiling water. We don't feel it overnight. So it just ends up being this thing that we kind of just keep dealing with and keep on kicking the can down the road. And, but the people around us over time are definitely going to notice it. My husband doesn't have that fire in him anymore. Like I said earlier, the honey-do list is getting longer and longer, and we just can't seem to get anything done. And I think it mentioned this earlier when you were talking, but the brain fog, boy, that is a thing. I see a lot of guys that are just like, look, I just can't get it together, to get my brain to kind of do what it was doing. And we do some of these either hormone replacement therapy or figure out how to correct some of these abnormalities. And all of a sudden they're like, oh my gosh, I'm getting so much more work done, and my motivation is so much better. And I'm my gym, my going to the gym is paying off. I actually feel a huge difference when I go to the gym. Yeah. So it's a big factor.
So I what I'm hearing you say is, I mean, that the way that this decline occurs in men is slow and hard to notice at times until it gets really bad and someone in the family knows.
Yeah.
But the benefits and the improvement in all of that is much more noticeable and rapid than that decline when it is appropriately treated and replaced if needed. Did I summarize that?
I think so.
Right?
And and I would say even on top of that, I mean, a lot of times because of the stigma of guys of just kind of wanting to, hey, whatever. Yeah. So I feel crummy. That's just how I feel. And the stigma that's been behind testosterone for so long, generationally, that's just we just feel crummy. Hey, look, you're over 40 and you're a male. You just feel crummy. Okay. So just deal with it.
You're going to be fat and you're going to be tired.
Yep. And that is really what they're finding is that's really doesn't have to be the case. And, interestingly enough, it's actually in most cases, it's actually the wife dragging the male in by the ear and going like something is not
because
right.
the mood thing
Yeah.
and the energy thing are what is noticed
Yeah.
there.
And then I get complaints from the wife that goes, look, I want everything else to improve except his libido. I don't want anything. I don't want any improvement there. I'm fine with his low libido.
I'm good with that.
I want everything else to improve though, because look, he's cranky and he's whatever. He's on with the kids or
I want him to be happier and full of energy and leave me alone.
Because we have stuff to get done.
Right.
So it's just
we're going to get in so much trouble.
Dynamic. Oh yes, I know. All right. Hopefully Susie will skip this episode.
So let's talk a little bit then about, so this is happening. We can address it. And I think how to address it, what to do about it. We ought to just do a whole nother show.
Yeah, I think so.
But let's talk about like the health, like you and I talk about weight loss and then healthy lifestyles.
Yeah.
Right. A lot. How does the testosterone relate to that? Like what, body composition and all those things, like what role does testosterone play in all these other things that we're talking about with,
it's a lot of it comes down early on to not being able to maintain good muscle mass. I mean, really, your muscles are the thing that just gobble up all that energy. You use your muscles every day. They're the biggest user of energy, right, that we have, to feed all the muscles. And as these muscles slowly decline because of testosterone not being at adequate levels, at good therapeutic levels, unfortunately, what happens is your muscles start to essentially shrink, and we're just not burning off as many calories. So you were eating, but our eating oftentimes doesn't change. And so we're putting in the same amount of energy in, but yet burning less. So, right, this ends up having to, everything starts to slow down. And of course, men are just really good at storing visceral fat around the belly area. You can almost predictively look at a male that even if like they have a thinner upper body and arms and legs, right, and then they have the belly. And it tends to be the hardest thing to lose. I see in the clinic when I do composition monitoring, I look at kind of the full breakdown of like how much lean muscle and fat and all that do they have. By far and away, you can have a 250-pound male and a 250-pound female, and the 250-pound male will have a double the visceral fat as the same weight female, same age, same everything else.
Wow.
And it's across the board. There are almost no exceptions to that rule from an anecdotal standpoint in the clinic. It is, I know for sure that the similar size female and male, the male is going to have significantly higher visceral fat. Why does that matter? Visceral fat is otherwise coined as dangerous or sick fat. This is the stuff that oftentimes leads to all kinds of bad things, including cardiovascular disease, risk for heart attack, stroke, all that stuff. So that's why this is all connected. We oftentimes view testosterone as like, well, okay, so what? We just want guys to have energy and better libido and feel better? No, there's actually really, truly health implications to this, including cardiovascular risks, including obviously, we have lower muscle mass and, so you're increased risk for even stuff like diabetes, right? Because the metabolic system, you're not burning as many calories. You're becoming insulin resistant. You watch these guys that oftentimes get their testosterone levels up and watch their metabolic function change, watch them lose weight, watch that belly start to shrink down, watch their muscles actually, they're able to maintain and grow.
Do they get jacked?
Some of them probably do, but for the most part, most of these guys just maintain good muscle mass.
Yeah, they just get healthy.
And we know that it makes their bones stronger, which is also very important. I mean, we work in the ER where, there's some of these people that fall, the wind blows hard and they break a hip. That is not what you want. I mean, it's one of the leading causes of older people. Actually, it's a huge risk for death.
It is.
So
I think it's a person over the age of 75 who breaks their hip has an average life expectancy of 1 year.
Oh my gosh. I mean, it's
a devastating injury. And it's kind of a corollary or a similar, a parallel to this. Like, the reason is that you break your hip, you become not mobile for extended periods of time. That leads to risk of infections. It leads to, muscle loss, further decline in your stamina and energy. And so it just kind of puts you in a situation where those things all decline. And I think that's kind of like a dramatic thing that we're talking about with testosterone, low testosterone. It insidiously changes your metabolism.
Yes.
It makes it easier. Low testosterone, as that declines, it makes it easier to deposit that belly fat and keep it and hold on to it, which in turn changes your metabolism more. It changes that fat to your muscle ratio, and it makes it harder to get up and exercise a little bit, move around. It just is this cycle that all the things play on each other. And lead to
definitely feeds into itself. Yeah. And we've talked about the insulin sensitivity and how important insulin is. We did a whole episode or two on insulin and the driver that is. And when you increase insulin sensitivity, that's a good thing. When you have decreased insulin sensitivity, we don't like that, because it just requires your body to store and store and store. And so, it's just so important. And when we increase that muscle mass, when we increase protein synthesis, even the way that your body uses and stores protein for your muscles and for all the other things, is greatly dependent on testosterone. It's just such a huge factor. And I like I said, I think testosterone has been narrowed down to, you even said it earlier, to a sex hormone that's in charge of just that.
Or you use it to get jacked.
Yeah. Or or on the flip side. Yeah. Everyone, just wants these massive muscles. And all stuff.
Yeah.
Once again, it comes back to, honestly, within just having a good normal testosterone. This is not for, someone that's abusing, steroids and all that stuff. This is for someone that just wants to feel good. If the worst thing that this person wants is to go to the gym and build muscles, is that really something we really have decided to critique? Like, is that something that we're going to attack?
Here we go again, attacking each other.
Yeah, it's just that whole thing that we talked about last episode with, like, we just, a lot of times
beat people down for what they're trying to do to improve their health.
So when someone wants to go get jacked in the gym, geez, let them go get jacked. Because
you know what happens when you get jacked? You lose visceral fat. You increase bone density. You make yourself more insulin sensitive. You decrease your cardiovascular. We go on and on about all the things. Like we joke about get jacked, but there are so many good things that happen to you when you have normal levels of hormones that drive so much metabolically in your body.
Well, and Rick hit on it earlier, and I want to reemphasize, this is kind of a cycle. It's a horrible cycle to get in, because your testosterone levels start to drop. You start to gain weight, and then you go talk to your doctor. They don't really check anything at first. They're like, look, yeah, you've gained a few pounds. So why don't you try dieting and exercising and doing these things that require, like, sometimes a lot of discipline and focus and energy and things like that. And it feeds into itself. So you don't have energy. You go to your doctor to say, I need help.
Energy.
I'm gaining weight. I don't have energy. And their answer to that is like,
do more things that require a lot of energy.
I'm like, we're not really fixing anything. We're just telling you it's almost the whole proverbial pull yourself up by the bootstraps and just get it done. Now, most guys do, right? But the difference between going to work and actually feeling pretty good and going to work just because you have to, there is a big difference mentally there. And it ends up being so much more challenging to get up and work out and lose weight and do all these things when you feel like trash. And does that mean everyone needs to be on TRT? No. But does it mean that if you have lower levels and you have the symptoms of that you need to work with your medical provider to figure out how you can address that.
Look into it. Not just a total testosterone level.
Let's not be in bad health for 20 years, feel like garbage for 20 years to wait to do something with this.
Even you almost said a word that we would have had to cut out. Oof.
Yeah, I know. What can we say on this channel?
Feel bad.
Yeah. My mom may watch this at some point. And you might feel not good.
Not good.
There's other expressions we could use.
When you're talking about, I totally sabotage your train of thought. But as you're talking about, all these things, like how we view this as getting healthier and all these good things. I lost my train of thought. We wouldn't say the same thing about other medical conditions, like the provider. Like, let me give you an example. So I go to the doctor and say, I'm having a really hard time walking across the street. I'm getting short of breath and I get really winded and I just can't walk very far anymore. Something's going on. And if my doctor, the advice was, well, you just need to walk more and walk harder and farther.
Crazy.
And I'm thinking in my mind, wait, how about we make sure it's not congestive heart failure or a chronic lung disease? Or, I mean, there's some things I think of that I would like, let's address some of these underlying things. That's kind of what it sounds like when, you just go do things that require more energy to get your energy up.
I know, it's wild and
make any sense.
Yeah. And it's hard because, like, once again, I mean, if the testosterone levels are low, and let's even say that a guy's like, look, okay, cool. Doctor said, just be more active. And let's say that he does all that, but now we have a lot of data that supports, like, if he's going to go to the gym, his gains, the amount of muscle, they're not going to be there. I mean, they're not going to be there. So, I mean, how long can he persist and continue to go and do that without seeing gains, without seeing results? And hey, my belly's still growing. I still feel like garbage. And
you can try and force your body to do something, but your body with a low testosterone level is working against you.
Yep.
And so, all that extra effort is really not, the benefit is you're robbing yourself of the benefit of those actions. And
we're going to get into next episode. We can talk, we'll talk about what to do about it. We'll talk about, should you, as a male or even as a female watching this, if like you have a loved one in your life that you've kind of been wondering about this, just give you more information to kind of understand, hey, what age range should I be looking at this at? What are some of the more common symptoms that I should be looking for that are truly like, hey, these are kind of, your testosterone might not be where you need it to be. And then also, just what are some of the treatment options? A lot of people think that testosterone is the only injectable testosterone is the only treatment option. There's actually quite a few good treatment options out there, including lifestyle. And we'll talk about some of the biggest things that impact testosterone levels and what can be done about it. And so that you guys have maybe a better idea and know what more questions to ask when you go see your medical provider.
Yeah. Awesome. Okay, we'll get into that next episode on what do we do about all this. Until then, have a great time. We have a good week. Stay active. We're hoping everyone here can attain and retain good health and remain healthier ever after.
Healthier ever after.
All right. Take care.